Welcome everyone. My PhD topic is the assessment of efficacy and safety of natural products in the evidence-based medicine. My name is Dorottya Bastidas-Gergő and I am a medical biotechnologist. My vision is that the evidence-based use of herbal products will be more widespread in the medical practice, and to achieve my mission is to provide scientific evidence for health professionals to facilitate their work and their evidence-based decision-making when applying herbal products. I have one submitted and two ongoing projects. The first one is peppermint essential oil inhalation as an effective treatment for nausea and vomiting. In this project, our aim was to investigate the efficacy of peppermint inhalation on nausea and vomiting compared to placebo, and for this we set up our PICO framework. The population is adult patients experiencing nausea and vomiting symptoms in 3 subgroups: postoperatively, due to chemotherapy, or during pregnancy. The intervention is peppermint inhalation, the comparator is placebo, and the primary outcome is efficacy assessed by the changes in severity of nausea and vomiting measured by different measurement tools. We conducted our systematic search in 5 databases, and after the full text selection, we got 16 articles to include in our project. And due to the short time, I will just present for you, for one subgroup, the results. So, in case of postoperative patients, they spontaneously enter the studies when they experience the nausea and vomiting symptoms. And their symptom severity score was assessed at baseline and 10 minutes after the intervention. We visualized our results in 2 ways. On the left, we visualized all the results. In this case, you can see a horizontal line, which represents the 0 effect line. And if a value falls below the line, then it favors the peppermint usage. Meanwhile, it's above, then favors the placebo. The x-axis shows the timeline. So, in case of 10 minutes, we can see that there is a statistically significant difference favoring the usage of peppermint oil to reduce the symptoms. On the right, you can see that we also visualized our results on a forest plot, and for the statistical analysis, we use standardized mean difference, because in the articles, they use different measurement tools. Here you can see the overall standardized mean difference was minus 0.62, and also the diamond shows that there was a statistically significant difference. The conclusions: postoperative patients after 10 minutes and pregnant women after 4 days of daily therapy experienced a decrease in the severity of nausea and vomiting, so they might need less antiemetic treatment to reduce the symptoms. But for chemotherapy patients, there is a conflicting efficacy. Our implication for practice is that peppermint inhalation may offer a safe and effective alternative treatment to decrease the severity of the symptoms, and also to increase the quality of life for the patients. And the implication for research is that although there are promising results, further studies are needed with larger patient population and also in multiple follow-up durations. And future studies could explore the optimal dosage, frequency, and duration of peppermint inhalation. We resubmitted our manuscript in July, and so far we are waiting for the report of the second reviewer. The second topic is Elixirium temicompositum in the treatment of acute bronchitis in pediatric patients. It's the so-called exotic project. Acute bronchitis is an inflammation of the large airways of the lung. Worldwide, 5% of the population report at least one episode of acute bronchitis every year. Although the disease caused most of the cases by viruses, there is a high 70% antibiotic overprescription rate for patients diagnosed with acute bronchitis in the US, and 44% of the total antibiotic prescription happens due to this issue. So still, although the patients don't need antibiotics, but they have the necessity to reduce the symptoms, and for that an alternative over-the-counter drug or product could be useful, and Elixirium temicompositum might be a good option. It is a Hungarian herbal medicinal product, and it is used for decades for the treatment of inflammatory processes of the upper respiratory tract, and although it is used for decades, there is no clinical trial conducted about the product. So our aim is to assess the clinical efficacy and safety of Elixirium temi to ensure its safe and rational use, and to reduce inappropriate antibiotic overprescription treating acute bronchitis. Our clinical question: is elixirium TIMI safe and effective in the treatment of acute bronchitis compared to placebo? And to answer our question, we set up our PICO framework. The population is pediatric patients with acute bronchitis. The intervention is elix TIMI. The comparator is placebo, which is identical by taste, color, and also the ingredients, except the active ingredient, time tincture. The primary outcome is efficacy assessed by the bronchitis severity score. And our hypothesis is that elixirium TIMI compositum as a standalone or add-on treatment alleviates the symptoms of acute bronchitis compared to placebo. And the clinical implication is that the product might be an effective and safe alternative or complementary treatment for acute bronchitis. So let's see, where are we now? We finalized the detailed eligibility criteria with the clinicians. Also, we finalized the pre-study protocol and almost all the documents and case report forms for the clinicians and also for the patients and parent or legal guard. Currently, we are organizing the International Trial Advisory Board, and we invited some experts on the field, and already one member sent us positive feedback. Also, 75% of the documents are already translated to Hungarian. The third project is assessment of efficacy and safety of peppermint during endoscopy. In this project, our aim was to assess whether peppermint oil could be used as a quick-acting, non-inferior, safer alternative on antispasmodic agents during endoscopy. For this project, we also set up the PICO framework. The population is adult patients undergoing upper endoscopy or colonoscopy. The intervention is peppermint oil. The comparator is placebo, and the primary outcome is quality of endoscopy assessed by the adenoma detection rate. We conducted our systematic search in 5 databases, and after the full text selection, we included 33 articles in our project. And now let's jump to the results. In case of colonoscopy, the adenoma detection rate was the primary outcome, which is the percentage of patients with at least one detected adenoma. In this case, we wanted to find out if peppermint oil can increase the adenoma detection rate compared to placebo. And for our statistical analysis, we used odds ratio. As you can see, the overall odds ratio was 0.97 with no statistical significant difference. So in this case, we can conclude that there is no difference between the peppermint or the placebo to increase the adenoma detection rate. The second outcome was the proportion of no peristaltis. In this case, during the endoscopist is assessing a peristaltis grade on a 4-grade scale from no peristaltis to severe peristaltis, and he assessed this after the treatment. In this case, we can see that the overall odds ratio was 4.75, and we can conclude from this that the peppermint oil usage is 5 times more the peristaltic. So overall odds ratio of 4.75 means that peppermint oil has a 4.75 higher antispasmodic effect than the placebo. We also checked the same outcome for upper endoscopy, and in this case, the overall odds ratio was 5.91. So also we can conclude here that peppermint oil has a 5.91 times more effect. So antispasmodic effect. So in conclusion, peppermint oil does not increase more the adenoma detection rate compared to placebo during colonoscopy, but it has a significantly higher antispasmodic effect compared to placebo during colonoscopy and upper endoscopy. So here you can see the progress of the project. We just got yesterday the preliminary figures, and also we are working now on the tables. In summary, I resubmitted my first project in July, and I would like to submit this year the other 2 projects too. So thank you for your attention, and I would like to finish my presentation with a quote of Marie Curie. "Nothing in life is to be feared, it is only to be understood. Now is the time to understand more so that we may fear less." Thank you.
My question is that you mentioned that in the endoscopy section, one of the things you measured was the detection rate. What do you think? How many bias it may be the difference between the examiners, their skills, their knowledge? So you can compare the result of two examiners that way.
Yeah, well, to be honest, there are the pros and the cons for this thing. Also, if we just talk about if it's unicentric or multicentric, there is the same question if one or more endoscopists do this. As I saw that in the articles, they took care of it, that they only hired endoscopists who did at least 1,000 endoscopies, so they considered them as experts. In that case, if only just one person do, of course, there is the danger that maybe it could be a good person, but do systematically something different. If there are more people, I saw, in that case, they try to do that way, that in both groups, they asked all the endoscopists to do measurements. So I think maybe that can make like less severe this limitation, but you are right, there is some.
Thank you.
Concerning the third project, I have recognized that some author is mentioned multiple times in NOAA, or I don't know how to read it. Can you tell me something about these studies? There was maybe 3 or 4 times this author.
Yeah, sure. And we can also go back to that, if it's possible. No, it's not possible. So in that case, that happened that only in one article, they used also air insufflation in one group and carbon dioxide insufflation in another. And it was paired with both peppermint and the placebo group. So in total, they had 4 groups. And we have the data for all the 4. So as I mentioned that we got yesterday the preliminary figures, then first we wanted to visualize all the 3 options, and our plan is that together with my supervisors and our statisticians and an endoscopist expert, we will discuss that actually which value to use in this case.